Welcome to another episode of Follow the Brand TV. I am your host, Grant McGaugh, CEO of 5-Star BDM, a 5-star personal brand and business development company. I want to take you on a journey through another deep dive into the world of personal branding and business development using compelling personal stories, business conversations, and tips to improve your brand. By listening to the Follow the Brand TV series, you will differentiate yourself from the competition and build trust with prospective clients and employers. You never get a second chance to make a first impression. Make it one that will set you apart, build confidence, and reflect who you are. Building your 5-star personal brand is a great way to improve your skills and knowledge. If you have any questions for me or any of my guests, please email me at grant.mcgaugh@5starbdm.com. Now, let's begin with our next episode on the Follow the Brand TV.
Five-Star BDM, Brand Development Masters, is a professional consulting and advisory group keenly focused on business development services for the small to mid-sized business and entrepreneurs. Although every business is unique, they often share business development challenges that can be addressed through smart branding. Services include process improvement and operations, digital strategy and transformation, business intelligence, digital marketing, and personal branding. Our business and personal branding company has helped a number of professionals and organizations to optimize and grow. This results in more business, more opportunities, better reach, positive outcomes. Visit www.5starbdm.com today to learn more.
Veterans face unique health challenges after service, often unmet by civilian healthcare systems. Ronald Steptoe and Warrior-Centric Health are on a mission to change that. We're the healthiest Americans going into service, but we often emerge with complex health challenges. With 79% of veterans living with at least one chronic condition, compared to 50% of the general population, the gap in healthcare is evident. Only 57% of hospitals ask, "Have you served?" A question that could transform care. Enter Warrior-Centric Health, a revolutionary solution addressing these disparities. This initiative is not just about healthcare, it's about honoring those who've served. We represent America, and we're redefining how healthcare systems care for our heroes. By turning challenges into actionable solutions, they aim to create a system that truly serves veterans. This is a $300 billion market opportunity, but it's more than just numbers. It's about serving those who've served us. Warrior-Centric Health is unlocking untapped potential, ensuring veterans receive the care they deserve. This isn't just a platform, it's a movement to bridge the gap in veteran healthcare. Steptoe's vision is clear: to transform veteran healthcare into a system that is profitable, impactful, and transformative. Warrior-Centric Health is leading the charge, turning healthcare challenges into opportunities for growth and change. Join the movement where innovation meets impact. Follow the Brand podcast on Spotify, Apple Podcasts, and 5-Star BDM.
And the interesting thing about Microsoft, most people don't know, is they have a healthcare division. And one of the key areas they have a focus on is population health and health equity. KPMG has a full health equity division. So people have recognized that this is a space. This is important. Medical care is critical for our nation to hopefully help us be able to moderate this increase in GDP in reference to a percentage of GDP that healthcare has. And one of the ways to do that is making sure that we bring equitable care.
Welcome, everyone, to the Follow Brand Podcast. We're going to take it all the way to D.C. I love D.C. There's so much going on in D.C. We just had some gigantic elections, good, bad, or indifferent. It is what it is, and we've got to move the ball forward. Now, I met my next guest at the NAHSE conference in Fort Lauderdale. He was in my town, so I got to be there. And he was one of the first speakers that I encountered. And I was blown away by some of the things that he was talking about, and especially when it comes to our veterans and healthcare. And I wanted him to have this candid discussion around what he does, why it is important, and for our audience to truly tune in. So I'd like to introduce you to Ronald Steptoe. Would you like to introduce yourself, Ronald?
Grant, it's an absolute pleasure to be with you today. Enjoyed our time down in Fort Lauderdale, again at the conference. And so I'm Ron Steptoe. I'm the co-founder and CEO of Warrior Centric Health. The company is based in the Baltimore, Washington area, specifically Ellicott City, so in between Baltimore and Washington, but it's a dynamic medical DoD tech. So all the things you can think about Washington, D.C. and Maryland and Virginia area, it's all that in this particular area. Grew up in the area, had a chance to go to West Point, met my wife there. And so we've settled back here in the DC area the past 30 years and really have dug into the healthcare and health tech space.
This is wonderful. And I like that. I like to get a little bit of that background story. That's the first question I want to talk about. That's the Warrior Centric Health. That is your company. You started it a while back, but there's a why. Like, why did you feel this was important for you to get started, and what is the organization all about?
So, Grant, that's a great question. So, if you look at Warrior Centric Health, one of the things that I had the pleasure of being able to do when I was in industry. So, just to give you a background, again, as I mentioned before, I'm a West Point grad. After finished the academy, had a chance to obviously serve the nation. And after the first Gulf War, which ended in 1990, 1991, my wife and I transitioned out, and I began to work for a company by the name of Pfizer in the pharmaceutical industry. So I started there at 26 years of age. And it's material what I'm about to share with you, because I remember having what we call our glossy and our slicks as I'm walking into Howard University Hospital, one of my accounts, obviously HCBU, medical school, and, hospital. And I go to the physicians and I say, hey, look, for this particular medication, this is the dosage you need. And they look at me and say, young man, I understand what your slicks are saying, but let me tell you what I have to do to actually get the blood pressure. I have to use double the dose or 3 times the dose to get the same effect. And at that point, I had a real on the ground understanding that while we may do certain things the same way for patients, we may have to treat them differently to get the same equal results. And I learned that at the age of 26. I stayed in the industry, in the pharmaceutical industry, for about 14 years. So I left at 40. So really a critical part of my maturation in business as well as a professional. And one of the things I was fortunate to be able to do my last 8 years working in the industry, in the pharmaceutical industry, but specifically for Pfizer, is I led the national ad hoc team called the Multicultural Business Team. What we know today as healthcare equity, healthcare disparities. I actually designed the business model for on how we were going to address that. So that's where I was able to connect the dots between, hey, there is this disparity, there are these inefficiency. Where is the business related to bringing efficiency? And I began to look at that at a very early age for understanding kind of the science and medicine at 26. From 30 to 40, really getting into the business of it. I'm now 59 years old, going on to 60. And so it's been a lifelong journey to be here today. But I think those are some foundational components to kind of understand what took me on this journey to get here.
Heck of a story. And to realize that medicine, just like in a lot of things, you can't treat everything the same way. There's a precision to certain things. And then there is some customization, some personalization that needs to take place. So it's just not cookie cutter. I want to understand now, there's challenges. One thing I know from your talk that you did back in Fort Lauderdale was around the facts of the data that was coming out around health equity and the veteran world in the healthcare world, I found the information to be startling. Now, that could be for me, maybe it's common knowledge. I don't think so. Talk to us a little bit more about that bridging that gap and the challenges that you come across when you're bridging veterans and underrepresented minorities in the healthcare system.
So I think a few things. One, when we look at the military community, I think the thing to start out with is we were and are the healthiest Americans to go into the service. There's a lot of different qualifications, and only less than 25% of folks actually meet the physical qualifications and other qualifications they have to actually even join the military. Okay, so let's put that there. The challenge is the military is exempt from OSHA requirements during training and deployment. How can you have OSHA and do what we do? Okay, if we were any other corporation in America, they shut us down tomorrow. Why are you having these people work in these conditions? But again, our job is to run to danger, whether that is the National Guard running to national emergencies or natural disasters that we have, the military doing what they do, firefighters, law enforcement. They're a group of people that run to danger on behalf of society. Okay, so let's put that there. What that then means, though, is that because of the nature of the work and the prolonged exposure that we do have, there is then a subsequent health consequence to that. So what you'll see on the other side of that is 79% of veterans have at least one chronic condition compared to 50% of the general population. When you look at our rates of cardiovascular disease, cancer, ambulatory issues, orthopedic issues, our respiratory health issues, it's significantly higher, anywhere from 10% to 30% to 40% higher than the general population. And so what is important to recognize in that context is that that is really one of the key components that makes us a vulnerable population, is because of the disparity and the higher prevalence of health conditions that we have compared to the general population. And people just maybe haven't thought about us in that way in the aggregate.
Very important. You bring up a good point. I mean, it should be just like in front of us. Just like firemen, police, they go into certain areas, certain situations that the normal population does not. And then you're going to have adverse effects that come out of that. But you brought up something, and I never forget this, because you're a data guy, and I'm a data guy.
Right.
You got a proprietary platform that we'll talk about as well. And you were saying, hey, you go to the hospital, any healthcare, you get a form, and on that form, you got to fill it out. And on that form, some of them, not all of them, but some of them don't really talk about your military experience as a part of the intake. You talk about, your past history, your family history, to understand, comorbidities that might, be or not be. But this is not there, because that's missed. Then you have adverse effects come out of that. Talk to us about that, and then talk to us also about your proprietary system that you made with your business.
Yeah, so I think that's another interesting question. So let's kind of walk this back a little bit. So first, only about 57% of hospitals ask the question, have you served? And less than 10% do anything with the information, according to an American Hospital Association Institute for Diversity report. Okay, so we recognize that as a specific challenge. The reason that has been a challenge, and is a particular challenge today when we talk about the warrior community. And when I say the warrior community, I include veterans, active duty, National Guard reserves, and their families. The reason that's a challenge in today's world, when we look at social determinants of health, is some of the key areas that we are now in our health systems monitoring is, what is the occupation? What is the education? What is the transportation of patients? What does the housing look like? Because we know from the front end of things, these social dynamics actually have an impact on health. In fact, 80% of health is really related to the social determinants of health. There's one other area, though, that we don't speak that much about, and I think is a critical area that is we're trying to bring forward in the discussion, and that's environment. What has been the built and work environment and the lived environment that someone is in? And that's where the military and veteran community, when we don't ask that question, becomes a key issue that we're not capturing. So the fact that we don't ask the question about military service or military affiliation to include the families is what's creating that gap right up in front. So let's again walk back a little bit further. With the World War II, we actually, I'm going to walk it back even further. After the Civil War, we actually, as a nation, particularly from the Union side of the house, actually tracked the lifespan of individuals that had served in the military. In fact, there was a study of about 35,000 individuals, and they followed them throughout their life. And what they were able to do was to say, how does trauma impact someone's health condition? And so they looked at 4 areas. Were they a POW? Were they injured during the service of the Civil War? What was their age? And then how many people were killed in their unit? The POWs, and if you're injured, that has a material impact on the health conditions that you have, whether it be cardiovascular, GI, nervosa, various other things in reference to the central nervous system. And they then looked at the age. What a lot of people don't know is we had people fighting in the Civil War that were 9 years old up to 17. That was one of the early age brackets. And obviously staggered all the way through to 31. What they found is that people between 9 and 17 that lived a long life wound up having higher incidence of various chronic health conditions than if they were older. Okay. So, and then the number of people that died in your unit had an impact, material impact on your long-term health outcomes. And they actually tracked people by whatever their profession was, whether they're a farmer, whether they're a carpenter, whether they were this. My point is back over 100 years ago, we thought social determinants of health was important. Yeah. In the context now, moving forward to now the electronic health record, looking at post-Vietnam, to World War II, we used to ask the question whether or not you served. But when Vietnam era came, there was a lot of stigma in reference to military service. And so somehow it just started to be taken out of the records of asking people about that. And so we transitioned to electronic health records. We just missed it. One of those situations where we wind up finding ourselves where we just, we found ourselves, and who knew we were going to 20 years of war. And so all these things coalesce to where we have this massive gap, and Warrior Centric Health's role and responsibility is to, one, address that. And I can now talk about the platform. And I wanted to kind of give that historical perspective.
Great segue.
Nothing's new under the sun. We've known how to block and tackle relative to this, and we just need to tighten a few things up. And we think that we have the capabilities and technologies to do that now.
I did not grow up at all with a military background. And so it really wasn't until I met Matt, my husband, that I was really introduced to this whole world.
Say hi fast.
Both deployments were similar in Iraq and Afghanistan. He was an MP, or military police. He later went on to the police academy and became a police officer, and he was still in the reserves. I actually remember very vividly that weekend. I could tell he wasn't right, but he wasn't complaining. He sort of had that typical soldier attitude of soldiering on, of just, continue through the day. And so I said, let's just go to the urgent care. And he told them that he wasn't feeling well, said that he had some sort of heaviness on his chest. And said, but it's just strep throat. Somebody else on my squad had strep throat. That's all it is. And they did 2 different strep tests. And they said, it's not strep. So we recommend some over-the-counters and a lot of rest. In the middle of the night, I heard what sort of just sounded like loud breathing, and I'm sort of nudging him, thinking it's snoring. And he's not sort of moving or acknowledging. And so I'm nudging him and nothing. And I hear this sort of like breath, like a big breath. And And then we buried him the following Monday. It wasn't possible. I know everybody says there's no way that could happen. He's healthy, all these things, or he's young, he's invincible. The story didn't play out that way. That wasn't how the story was gonna go. It wasn't until years later that I really started to look into it and wonder how this happened. I'm looking at everything. I am 2 a.m. researching anything I can find. And so it really was trying to piece together a massive puzzle. Both deployments were similar. There were high levels of toxins. That was not something that would be allowed here in the States. So he was breathing that in, and he was right there. He ultimately passed away from myocarditis, which is a scarring of the heart and the lung tissue. I think we know more and more that it's causing issues that might not be impacting people today, but if you think about myocarditis, that alone is something that people can have quietly. And what happened was he just got a viral infection, and his body was not able to handle that. He literally was at work the day that he came home and never woke up. I think my husband's reluctance to talk about it is probably a shared experience with a lot of veterans. You're sort of taught to keep going. Had they asked the question, had somebody made a connection of, this person's sick, they're complaining about their chest, and they were also deployed in a combat zone, we might want to do additional testing. Any raising of the hand to say, I think something's wrong, is deemed weakness. And I think that's what I would change, is to remove the stigma of weakness around saying I'm not well.
Well, this is what's important. You have to have the background story and understanding what's there. I'm intrigued about, first of all, you say you're in pharmaceuticals, and then you identify the gap, and then you eventually got into your own business and what you're doing now. But you developed this platform. You have a, and that takes a lot to do. So I want you to talk about that platform, what the data that it's capturing, and what its output or outcome that people get out of that, and why people, organizations like Veterans Affairs and others want to do business with you.
Yeah, thank you. I appreciate that. So interesting enough, when in 2008, people may remember we had been in war for about 7 years. There was a big scandal at Walter Reed as it relates to not having the capabilities to really care for everyone. And so there was a report called the Invisible Wounds of War report that was commissioned by the RAND Corporation to put together. And one of the 4 recommendations was that there need to be a uniform platform, or at least education, that would train folks on understanding this new phenomena of PTSD, post-traumatic stress disorder, traumatic brain injury, because we were seeing a lot more of that, as well as military culture. And again, from my background, what I was doing in the pharmaceutical industry, I was like, oh, I know what this is, and I know how to build what that recommendation was. So we really had a blueprint already on what needed to be built, but they said that need to be some type of platform that would educate not only the DoD, the Department of Defense, the Veterans Administration, but also commercial healthcare, because service members, veterans, and families are touching each one of those 3. So we had a chance to get in contact with Walter Reed. We submitted an unsolicited proposal saying we have some ideas on things we've been doing in industry to bring into the military, and we've got a contract to actually begin to develop this idea, this concept of how we really bring together integrating some of the data where we're finding the gaps. Once you identify the data gaps and the clinical gaps, how do you create the clinical medical education specific to the military needs? And then how do you develop a platform that actually began to develop communication tools, not only for the providers, but to patients? So we really were an IP, intellectual property business, starting out on the ground, Walter Reed. And we have since won 8 DoD contracts in the R&D space. So we stayed very, very close, not specifically on the VA side, but on the Department of Defense side. Yet we do have some data partnerships with the VA. We still have access to a lot of the studies they do because, again, they've got longitudinal studies they've taken and have developed. And the question is, how do you codify that information into a commodity of education that providers can consume, not only within the Department of Defense, but also in the commercial sector and particularly within the VA as well. So if you think about it, anything, we're an IP engine, we're an intellectual property engine. We look at the data, we scour the data, we scour policy statements, we scour and determine what are the next best practices that folks say should be built. And then we put in place the tools and solutions on what the policy people say should be built. We didn't go build. So we're not building in the blind, we're building to policy.
Yes, yes, this is important. And you bring up another good point because veterans aren't just, once you serve and you get out, you go into the commercial world, enterprise world, and you're making your way. Some take advantage of veterans benefits, some don't. They just do regular insurances and that kind of thing. So you have specific data that a lot of these other health systems or HIT systems don't have. Therefore, you can start because you build partnerships with like KPMG and Microsoft and some others. Why is your data so valuable to these types of groups?
So that's another really intriguing question. So the interesting thing is that data actually is out there and it exists. The government's been studying us. I tell you, they've been studying us since the Civil War. Okay, we call ourselves G-men and G-women. They got our social security numbers. They know exactly where we live. They keep track of us. And interesting enough, knowing that, there's data on us sitting with the CDC, sitting with the VA, with the DoD, with CMS, with other agencies. We actually go find that data. We actually pull it out, but it's sitting in raw Excel spreadsheets. No one ever thought about bringing it together. And we have some algorithms and things that we do to say, okay, let's align this data. So we mine and align the data on our population. That alignment then begins to tell a story. That story then begins to tell you, so for example, we can tell you based on the data in a particular geographic area down to the zip code, how many service members are in a particular, or veterans are in a particular marketplace, what branch of service they were, what their ages are in the aggregate, what their race is, what era of service they were serving in, and that era of service will tell you what they were exposed to in various parts of the world. We then know, based on those toxins they were exposed to in the various parts of the world, what health conditions are going to come off of that. So for Vietnam, it was Agent Orange causing some respiratory issues and some cancers. And Iraq and Afghanistan, it was oil wells and the first Gulf War and burn pits in the second, as well as sandstorms. So that really begins to frame out what health conditions may actually come off of that. We walk into a health system presumptively with that information. And so we're saying with this number of people from this era, let's say they may be Gulf II or the global war on terror versus Gulf I. And Gulf I, there would have been exposed to oil fires. That's going to cause this. You should be looking and training your docs on these issues. The Gulf II actually is global war on terror. They saw a bit more of these. These are the health conditions, even with the PACT Act. The PACT Act that was just passed in 2022 specifically listed 13 respiratory health conditions and 13 cancers that actually now are presumptive if an individual was step 1 foot over there during their time in service and they have these conditions, they're presumed to have that. So this data all exists. This, and the PACT Act is a law, and they, have the VA saying you need to move forward in this. Here's the key thing. The majority of veterans, of the 18 to 19 million veterans, only 9 million are registered with the VA for healthcare services. Only 6 million get their care at the VA on an annual basis. And here's the key statistic. Of that 6 million, only 12% of male veterans get their care at the VA only. Only 20% of female veterans get their care at the VA only. So nearly 80% of veterans are getting some or all their care in the commercial sector. And so if we've had all these exposures, 79% incidence of at least one chronic disease versus 50% of general population, and we are asking the question, how can you possibly give a correct differential diagnosis? That becomes a quality and a safety issue.
Brain injury and post-traumatic stress disorder are two well-known signature wounds of the wars in Iraq and Afghanistan.
But for some, their injury is hidden.
Tens of thousands of U.S. veterans who served in Afghanistan and Iraq are sick and have had to fight to get their illnesses recognized as linked to their service.
Only 57% of hospitals ask the question, have you served? And less than 10% do anything with that information.
When transitioning out into the private sector, that aspect of your life gets lost.
So therein begins the misunderstanding, the underrepresentation, and the inability for the healthcare system to provide care that is safe and care that is high quality. Of the 1.6 million individuals that have been deployed to Iraq and Afghanistan, about 300,000 we estimate will suffer from post-traumatic stress disorder, PTSD, and another 340,000 will suffer from traumatic brain injury, TBI. This is healthcare disparities.
When I went in, I was connected to a combat support hospital, and the call came that we had an emergency coming. And I'll never forget the helicopter coming in, and it came in so fast. They asked me to switch and go to chest compressions, and I remember for about 40 minutes doing chest compressions, and every time that I would do the compressions, blood would just shoot out.
Every little bit of our life adds up to who we are. But if there's been trauma in your life, that adds up as well.
The reality of that really hit me. I came home a different person. And my wife was young. The person she married wasn't the same that came home. No civilian doctor has ever asked me about my military service.
Unfortunately, most do not recognize that they are serving the military and veteran community. There is a general assumption that veterans get all their care at the VA. Of the 18 to 19 million veterans that exist, about 9 million are registered with the Veterans Health Administration. Only 6 million veterans get their care at the VA on an annual basis. Of the 6 million that get their care at the VA, only 12% of male veterans get their care at the VA only. Only 20% of female veterans get their care at the VA only, which means close to 80 to 90% of veterans are getting some or all of their care in the commercial healthcare sector.
So I think one of the most important things is asking the questions when a patient comes in, have you ever served? And if so, did you deploy? If you serve in a desert environment, and a very arid environment, if you serve in the jungles, all of those things can adversely impact your healthcare, not just when you're actually serving there, but for years down the line.
That means that they have environmental exposures that we've now seen via the PACT Act that are not being caught and assessed early enough in the commercial sector.
When I went to work in that hospital, the entire time we were there was when they had lit all the burning oil wells. 7 or 8 months after I got back, I was working for a company, and when I first went to work for them, I had to take a breathing test. And I failed it twice. And I collapsed in the middle of the night on the job, just went out. And it wasn't until my amazing nurse practitioner, she heard something and she said, I want to get you a PFT test.
Let's begin to ask the question, have you served? Let's get the social history and let's get ahead of the curve and really put together a care plan that we think can optimize not only improving safety for service members, veterans, and their families, but also the quality of care that's delivered to them.
So we actually memorialized that in the electronic health record. If we admitted you as an inpatient, we identified you with a wristband to indicate that you were military.
You just want to be as respectful as possible.
Because their service has been impactful and their service means something, and they should live the best life possible. One of the ways we can help is to help our service members be healthy and well. And the commercial healthcare sector has the capacity to do that.
I would agree with you 100. And as you just stated that, I begin to look at, wouldn't the payer community want to have that data because they've got a population model or whatever they're using for their framework in that particular sector? And you're like, hey, you know what? We've got a huge veteran population here and that we're going to have to serve. And we need to understand, whatever the conditions may be, so that our pricing and how they do contracts and things like that. I find that very valuable. Have you found you have discussions with the payer world and said, hey, you need to come in and talk to us, Ron? Let's sit down and have a conversation.
So it's public knowledge. We have we did some work with Kaiser Permanente, so they actually are very interested in this, as well as Vizient. In fact, Vizient published a particular paper, which is called the Veterans Field Guide. And what happened was in 2014, 2016, we worked on a data project with Lehigh Valley Health Network. And they had some military folks that were there. And Lehigh Valley was really, from what I could see, and I've been all around the country, was the first health system to uniformly begin. They asked the question, have you served? At the time, they had 5 hospitals. So they actually went in, adjusted their EHR. What most people don't know, it's not the veteran, while it may be an Epic and Cerner, it's not automatically turned on. You have to go turn it on. Okay. And then even if you turn it on, does it ask a series of questions like, when did you serve? Where did you serve? All those things. So that's a gap that's in the market right now that we're addressing. Anyway, they began to ask the question, have you served? And here's what they found out. We walked in with the data saying 7% of your population are veterans. Okay. When they began to actually look at the data, they found that 10% of their inpatient and outpatient foot traffic came from 7% of the population. When they looked at the GRGs, okay, to actually look at the diagnostic codes that they were serving, they found that 13% of the revenue came from 7% of the people. When they then did the assessment and looked at the readmission rates, veterans had a 36% readmission rate versus 25% of the general population. So we fight above our weight class in bringing revenue to the table. From a cost perspective, we have a disproportionate number, higher prevalence on the 36%. So no health system wants to take the money off the table. The question is, how do we do better? And right to that. So I think you're right. The insurance payers would be very interested in understanding this marketplace. And again, that was just the veterans. I didn't include the National Guard, Reserve, active duty in that. So it's a very interesting and I think a vastly misunderstood opportunity, financial opportunity for hospitals and health systems. And that's what we want to bring out to them, to say why you're addressing healthcare equity, healthcare disparities with the new CMS requirement for health equity, with the National Patient Safety Goal for healthcare equity with the Joint Commission. While there is the requirement to meet those regulatory and accreditation requirements, we think that there is a tremendous market opportunity to better serve this patient group. And one of the things we say that our IPMH platform, Integrated Military Population Health Platform, facilitates, definitely on the commercial side of the house, is a way to have health systems and hospitals, if you don't mind, somewhat be the USAA of healthcare powered by our platform in their local markets. Because USAA, the military and veteran community, has a tremendous brand connectivity. I mean, majority of service members have some connection to include our families. We believe that that model and that modeling and reference to brand connectivity, especially as health systems are really becoming brands, how do you connect that? And so our platform allows and facilitates hospitals to be able to do that in their local market. And our
Now I'm
partnerships.
interested. You got me really interested. And I want you to talk to me as if I am the CEO of a major health system. That, and a lot of these systems now aren't just providers, they are payers as well. So both, like you mentioned with Kaiser, so this model is happening, but we've got to be able to serve people and to serve people in an equitable way. How do I get you integrated into my system? What's the process of bringing you in, setting you up, and then realizing the benefits of your program?
I think first of all, there are two things that we try to explain. And what we did with our platform was align it to something that hospitals have to do. Because right now, they're so busy. I mean, so many new technologies, new platforms are coming. How do you make a choice? They just don't have time and space. So I think it was very fortuitous for us to be able to say, okay, wait a second, our platform really aligns in principle with each one of the elements of the National Patient Safety Goal to improve healthcare equity that the Joint Commission has come out with. Each one of the 6 pillars, the first one being that, hey, look, we need to identify a leader. Number 2, we need to stratify the health-related social needs. Number 3, we need to determine what the gaps are. You then need to determine what are the best practices for processes and training. You need to evaluate your action plan that needs to be written down. You need to assess that action plan and need to report that out. Well, through our partnership with Microsoft, all of our IP that facilitates that sits in almost every computer or every hospital and health system. They all have Microsoft. So literally, email, password, you're into our platform. Pretty simple.
Nice.
Number 2, how do you then make sure that while the intellectual property on the data and the education and communication tools are being dispersed in a programmatic way to align with the National Patient Safety Goal for healthcare equity with the Joint Commission and CMS requirements, how do you then make sure you have the proper implementation science? And that's where KPMG comes to the table. They're excellent at making sure that we're able to have that assessment. So it's a collaborative teamwork where we're using the National Patient Safety Goal as a thing that the hospitals have to do. The question is they have to pick a population. So is that going to be people of color? Could it be LGBTQ? Could it be the elderly? Could it be maternal care? What we say in our context is that the majority of those individuals are in our community anyway. So if you're picking us first, at least pick a second because we represent America. So that's point number 1 in reference to a regulatory accreditation requirement. You have to do something. So this is a population. Then there's also the business side. The business side is, wait a second, 97% of service members have some level of insurance compared to the high 80s or 90% of the general population. You have more chronic conditions, you're going to get them earlier. And that means you're going to tap my cardiology, respiratory health, oncology, orthopedics. As a hospital and the health system, as an IDN, you're going to be touching a lot of my touch points, a whole lot more than the general population, and you're insured, and I get you younger, and I get a chance to manage your health and optimize that. No one ever put our population in that type of framework before. And when you look at the military and veteran community, again, our families serve as well. They have stressors as well. So you get a chance to, again, sure this market that represents in the aggregate about 25% of the US population. And if you look at the insured value of just, again, that's about 75 to 80 million people. Let's just put a $5,000 price tag on per person. We know it's more. We know it's 8,000. Let's use 5. That's $300 billion of annual insured value that is flowing through hospitals, many of which they don't even know exist, and they haven't connected their brand to it. So it's a market to grab. And then number 2, that is $100 billion more than the entire oil and gas revenues in the United States. So it is an incredible market opportunity in addition to an opportunity to fulfill a regulatory requirement. And at the end of the day, from a social perspective, we're taking care of those folks that run to danger on our behalf. So you're fulfilling also a public safety and national security fulfilling on, I say, the mission of making sure our nation stays secure, because not many people run to danger, and we don't take care of them. That could create some challenges for us moving forward in the future as a nation.
Follow the Brand TV broadcast host, Grant McGaw, as he visits with top executives and entrepreneurs to find out their secrets of success with their personal brand. Follow the Brand TV broadcast host as he focuses on brand development to build better relationships, bring value to your business, relationships, and career. You will enjoy listening to each episode that is tailored to speak to you directly. If you're looking for this type of clarity in terms of building your brand, you have tuned into the right station. Each episode will help you to shape a conversation in the 5-star BDM network of 20,000 professionals and become a springboard for your corporate engagement and business opportunities. Each guest will frame their story in the areas of personal branding, business development, career development, financial empowerment, and technology innovation. Grant McGaw explains why he is the CEO and owner of his own professional career. Grant is an accomplished business leader and entrepreneur who wants to give back to individuals to grow their personal brand strategy. Tune in as he weaves his story about new possibilities, while to you exceed expectations. If you love storytelling, this show will make for fun.
I totally agree with that. You tick two of my buckets in that. First of all, it's profitable. It makes financial sense. And then it has social impact. It has, the impact of social good is there, the goodwill that we need in the community, and the branding of that, that you can lead with, hey, we are prioritizing our veterans for their health and their safety. As you just said, they went out, they put their life on the line for us. The least we can do is put our life on the line for them and make them a priority and say, hey, here's our veteran track for you and your healthcare, and this is what it looks like. That makes a lot of sense. Now I want to ask you this from a pricing perspective. I say, yes, I love what you're saying. Let's bring you in. Are you a model that, is it monthly reoccurring that I'm paying? Is it a one-time cost? Talk to me about the pricing model.
Yeah, that's great. So one of the things we've done is we've aligned our pricing model along with the every 3 year that the Joint Commission is coming in. Okay. So it's a 3-year platform because, again, change management takes time. And so we place it in such a way that the institution has ability to flex and move in that context over the 3-year period of time. So it's a subscription-based model. We have it outlined, let's say, for example, a major big hospital system. They've got thousands and thousands of people, right? And I'll break down the pricing. This is more of a big hospital, not necessarily medium or small, but let's take the big one. It's about a $660,000 over a 3-year period of time, okay? But remember, over a 3-year period of time, that's about $220,000, okay? Now, from our perspective, as it relates to having to identify a population, meet the TJC requirements, the Joint Commission requirements for the National Patient Safety Goal, that's an FTE and a half. That if you're not using our platform with everything already built, the implementation team, the technology to come, you're going to have to build that. And for an FTE and a half, we already have that going. The upside of that is you have tens, if not hundreds of millions of dollars sitting in your marketplace. By leveraging our platform, we give you the marketing tools. So we always tell folks to take a look at it. If you look at the spend, it winds up being less than 0.5% of the market opportunity that you're going to try to go after. So that's what makes us different than many other tech platforms that you see coming in. We aren't a cost center. We are a profit revenue generating center. We are a technology and a platform that brings a market. And you very rarely see that in health technology.
That's true. That's true. Most of the time, most organizations look at technology as a cost center and not revenue generating. But that's such an outdated model, in my opinion, when you start looking at today's NASDAQ and you look at the top companies that are there, they're generating enormous amounts of revenue on a technology platform. How can you look at that as just a cost center?
Can I add on that? It's interesting point you bring that up. So I want to merge a few things and ideas. So I'm very fortunate. This top here is for West Point. This next one here is for Oxford University. So I was very fortunate to be a part of a group that goes to Oxford University every year to talk about innovation. And one of the things is the byproduct of us actually participating and me being one of the initial 50 American business people to be a part of that ecosystem. 90% of the S&P's value is in its IP. It's not its brick and mortar anymore. It used to be maybe 70% in the, call it 1970s, but today, 90% of the value that is in the stock market, and particularly S&P 500, is IP. What we allow the Warrior Centric Health is to transfer our IP into a health system's capability. So now they're leveraging our IP as their IP to tap into that marketplace, utilizing technology they already have.
Yes.
They're already paying for it. We've just plugged our IP into it. And the interesting thing about Microsoft, most people don't know, is they have a healthcare division. And one of the key areas they have a focus on is population health and health equity. KPMG has a full health equity division. So people have recognized that this is a space, this is important. Ethical care is critical for our nation to hopefully help us be able to moderate this increase in GDP in reference to a percentage of GDP that healthcare has. And one of the ways to do that is making sure that we bring equitable care as the nation becomes more minority majority. And so I think it's really, really important. I hadn't kind of thought of it this way, but what we do imbue to our peers, our IP, so they can leverage their IP as their IP to actually move forward in their local markets.
So important to understand the value chain and where we're going. And you both know, we all know that healthcare is very expensive and the current model is outdated. And we got to change. And there's no question about that. We have an elderly population. You know, my stepfather's still living. He's, in his 80s, served in Vietnam. And, I didn't even think about all these other Agent Orange, some other stuff, but I didn't think about so many others have served and that type of thing. And they're doing all kinds of things. Now they're no longer connected to the military, so to speak. But they're carrying around those traits and things, and they don't even know or unknowns that are there. But if our health system understands it, because preventive care is becoming so big, if I can catch it early, I can help, because urgent care and critical care and long-term chronic disease is what's driving up all the costs. So it becomes in our favor to get this early. You have a great platform for doing that. I have not heard of many, and I've been in the health technology space for a long time. I like your use case and what you're bringing to the table, and you're showing that, hey, adopt this technology, adopt this platform, and you can generate new revenues. And you just alluded to what's on the NASDAQ. Well, what is the IP? You've got to utilize this IP to leapfrog you ahead. And, the margins in healthcare are very, very slim. Why not improve that, right?
It's interesting you bring that up. I appreciate you saying that, Grant, because you've really driven into a particular point. And let's use another use case, okay, to show really how this can really have a critical inflection point. Women's health. What was women's health 50 years ago? It wasn't a thing. But you very rarely can find a health system that doesn't have a women's health practice today, right? Why is that important? Because at the time we didn't have the technology, and everybody was doing what they thought their version of women's health was, and it was very disparate. So it evolved, but it took time to do it, and now we see it as a major population health practice area. What we're saying today, and we're starting to see this with our LGBTQI populations as well, realize that, wait a second, certain groups of people have different experiences. And so we see these population health areas that are emerging. What we're saying in the context of the military and veteran community, it's very dynamic. It has some real significant health challenges, but also opportunities. But we can leverage technology now to be able to scale uniformly using our platform so everyone doesn't have to do their own different thing. How are we learning from each other? How are the best practices? So I used the women's health as a basis of what we had to do. And we don't have to get a donor to build a building. Let's just input the IP into the organization as you feel necessary, and allows for an incredible efficiency as we're bringing custody patients in, because we didn't have to have that hardcore brick and mortar build anymore. Let's input the IP into the brick and mortar you already have.
Yes, yes. So what you have with your business and what you're doing, what I see from my lens is that you have ease of use, right? You have proof of concept. It works. And now you have awareness. You've got people need to be aware of your capabilities and then how to utilize it. So my last question is very simple question. How do we get in contact with you, Ron? Because we need you to book a meeting and have you come on in here and have a conversation.
Well, I appreciate that. So obviously I can be reached at ron@warriorcentrichealth.com. Obviously, you can be reached on Twitter, LinkedIn, and Facebook as well. But direct email to myself would be great, or admin@Warrior Centric Health will get to my assistant and she will forward that on to me. But I appreciate the opportunity. I think that this is a tremendous time for us in this nation. I think it's a tremendous time for us to move ourselves forward. And I think with technology, with partnerships, we have a tremendous opportunity to move the needle and really allow for some incredible transformations to take place.
Absolutely. You've opened my eyes. When I first was introduced to you and your business, I kept thinking of it from a military standpoint, that, all right, that's just in the service world, not looking at, no, it's a veteran. So as a veteran, you're in everywhere. They're everywhere. They're not just, just connected to the active service, as you were saying before. It's not just a federal government type of application that you have. Is actually very commercial, very enterprise centric, that includes all these different levels because it's people centric, and you're focused on this population that is underserved. How can we do that? And before I let you go, because you mentioned something to me earlier, so important. We just celebrated Veterans Day earlier in November, but you have stated that it's looked upon a little bit differently. Talk to us about that.
Yeah, so we've recognized that obviously Veterans Day, while absolutely awesome for us to recognize that, we now have Veterans and Military Families Month. So, the nation, the U.S., I will give us credit compared to other nations, believe it or not, many other nations don't revere the people that have served as we have done in this country. So we obviously have Veterans Month, which is awesome, but we also have Memorial Day that comes up, and we have the 4th of July that comes up. So, we've got this, we have this we have this awareness, which is really, really cool. But the fact that we focused on a particular month in November is awesome. So this is very, very timely, and I appreciate this opportunity.
Well, Warrior Centric Health is on my radar. I want to get you plugged in. I want to see you down in South Florida doing some major business with our healthcare systems here, and that we can make a major impact.
Well, we would love that, because the number one number of veterans is in California, number 2 is Texas, and number 3 is Florida.
Well, with that said, this is wonderful, and I want to encourage your entire audience to tune in to all the episodes of Follow the Brand. They can do so at 5. That's the number 5, Star BDM. It's STAR, B brand, D for development, infomasters.com. This has been wonderful. I want you to continue to do what you're doing and to have a very wonderful holiday season and into the Happy New Year of 2025.
To you and your family, Grant, and your audience, wishing you all the very same.
Thank you very much.
Tune in for our next show or click on our website at www.5starbdm/followthebrandtv. Thank you.